Hi everyone, this is Communication Training by Sylvia Gossard. Effective communication creates consistency, it fosters a positive and productive work environment, and it increases quality of services provided. This training will focus on ways to improve communication skills, ways to decrease misunderstandings between staff, and remaining professional in a variety of settings and situations. The objectives of this training are to understand the principles of effective professional communication in an ABA setting, to identify when and how to communicate different types of information, identify ways to efficiently and appropriately communicate concerns, recognize common barriers to communication and identify strategies to overcome those barriers, and identify and utilize best practices for maintaining professional communication in stressful or challenging environments or situations or circumstances. So some of the principles of professional communication, effective and professional communication is clear and concise with simple language. It is direct. It is honest. This is how we build trust. It is respectful. It is mindful of your tone and your volume, and mindful of your body language, your gestures, and your facial expressions. Effective listening is empathetic. So we need to remember that there's a person on the other end of this. And effective communication is also empathetic. We need to remember that sometimes the person that you're speaking to likely has different experiences than you, and they might take certain things to mean things differently than you. So we need to just remember that to have empathy and treat people with kindness. Effective listening is also active, so that means nodding, leaning slightly forward, verbal affirmations like I see or I understand, eye contact, asking clarifying questions that restate what they've said, to assure that you've heard it correctly, but also to reassure them that you've heard what they've said. And then mindfulness of your body language, your gestures, and your facial expressions. So some common barriers to effective and professional communication. Some of the physical barriers would be noises, distractions. Some emotional barriers might be stress, discomfort. That could be temperatures, that could be hunger, that could be fatigue. It could also be frustration, anger, or anxiety. Heightened emotions can present a barrier. Some cultural and language differences can create misunderstanding, especially if there are different levels of language proficiency. If you're using English and it's a second language for the other person, that can create some barriers. Also, differing cultural communication norms. So different cultures communicate in different ways, and nodding and affirmative kind of body language in one culture could mean something different than it does in our culture. So it's important to be cognizant of that. Also, perception. It's important not to make assumptions. It's important to check your biases, and it's also important to find ways to make sure that we are understanding and not misinterpreting actions or words. So some strategies to overcoming barriers would be to find a quiet, distraction-reduced environment. It would be self-regulation, things like slow, deep breathing, or maybe grounding methods to reduce your emotional response. You want to get back to baseline. You should choose clear, concise, and simple language that is easy to understand but gets to the point. You should ensure and confirm that you're understanding what they are saying by seeking feedback and asking clarifying questions. You should check yourself for biases or assumptions, and then you should be flexible. So sometimes you're gonna have to be flexible when dealing with people with respect, to be being respectful and empathetic. Sometimes your ideas coming in are gonna change, and you need to be open to that. So these are some best practices. You have a handout of this here on the right. But some best practices would be keeping communication clear and frequent, seeking feedback regularly and encouraging open communication channels with reassurance, frequent check-ins, and open-ended questions. So keeping communication clear and frequent and then checking in regularly are all going to help keep lines of communication open and build trust and build that relationship. You also need to get comfortable with feedback. Feedback can be really, especially if you've had experiences in the past, it can be a very negative thing for you, and it can be very triggering to get feedback, even in the best way, with the best intentions, from the kindest deliverer. It can be really uncomfortable. So it's important that we get ourselves comfortable, but that's also where empathy plays, and it's important that we remember that people have experiences totally separate from us, and that these might shade their experiences or their reception of your feedback. So it's important to get comfortable receiving it, but also to get practice giving it in a respectful, kind, professional manner. When you're providing feedback, stick to the facts, the ABCs of the behavior, not emotions. So we want to say, this is what the setting was, or this is what was happening, this is the behavior, and this is the effect that it had on the people or the environment. So it's important to try to separate your emotions from your feedback that you're giving. Also, focus on, and also to separate your own emotions from the feedback that you're receiving, to stay calm. And remember that feedback is often just an opportunity for you to learn and grow. It's not meant to be an attack. So also we want to focus on the best interests of the client when we're communicating with the team. So in ABA, we all are working toward the same goal of our client's growth and progress. We need to remember that and focus on that when we are communicating with each other. Also, if you're having strong emotions associated with the information that you're trying to communicate, consider whether it might be in the best interest of everyone for you to wait until you're calm to deliver it, if it can wait. So over to the handout, we talked on empathy. It's important to have empathy with our communication, being kind and flexible, not to make assumptions, active listening, which is eye contact, leaning, nodding, affirmative statements, open and inviting body language and facial expressions that are neutral or maybe a slight smile. It's also important to be clear and concise, so keeping it factual, sticking to the ABCs, solution-oriented. Also getting comfortable with feedback, which we touched on. It's an opportunity to improve, so practice giving it, practice receiving it, practice soliciting it from others. This is going to build trust, and it helps build communication, open lines of communication. And then also keeping it client-centered and remembering that we're all working toward the same goal. And so let's focus on solutions rather than criticizing others or our emotions. We want to keep it focused on the facts and focused on what we can do about it to change it in the future. So communication with technology. It's also important to know how best to communicate things with when you're using technology. So you want to make sure that you're using the right modality: email, messaging systems, phone calls. So lengthy or more complex information that's not immediately pressing should be communicated via email. But if it's more pressing, it can be communicated through preferred messaging systems, like whatever's been communicated between you and the BCBA, or in person, depending on the nature of the information and the availability of the BCBA. They might not always be available for you to seek that in-person feedback. Also, safety concerns should be communicated immediately to the BCBA or other admin staff, and you should always proofread and consider the information that you are conveying from the unique perspective of the recipient. So we have a quiz here. You can pause and go through these different questions, and I would like for you to discuss them with your instructor. And then in conclusion, effective professional communication is essential to maintaining positive relationships and delivering high-quality, client-centered treatment. Improving communication, remaining professional, and overcoming barriers creates a more supportive and collaborative environment. Professional communication is factual, respectful, and empathetic, and it is important to practice and reflect on these skills often. Thank you.